Well, a big milestone for the Ontario's medical labs this week as they pass the 10 million mark for COVID-19 testing since the pandemic began. Joining us now with more on this is Michelle Hoad, CEO of the Lab Professionals Association of Ontario. Thank you for making time once again, Michelle. We appreciate it.
Good morning.
So I'll begin with asking you about this milestone. Tell us more.
Pretty exciting. We started the pandemic understaffed. We've got our lab, I think we've talked about this a lot, working 24/7. Today is a day that I think everybody in Ontario needs to put their hands together and actually applaud this group. They've hit 10 million, and this doesn't even include the variant testing that's now going to start. So it's a group of people that I think every day we need to appreciate. You know, we wouldn't have any results at all in our healthcare system if it wasn't for this group of people.
Yeah, a really important job. And we know that lab technicians are working so hard during this time. Michelle, tell us about whether you think these professionals can keep up with the pace, because as you mentioned, the variant, obviously a big concern, a couple of variants at this point, big concerns, and we're going to need more testing in the months ahead.
It's a really tough situation. It's hard. You know, there's actually two groups. So we call them medical lab assistant technicians on the front end, and then the technologists, the ones actually in the lab. They are working together. Can they keep this pace, Chanel? You know, it's really hard. We thought they couldn't, but they do. The effects we are starting to notice. They're telling us that it's affecting their home life. There's a lot of people who now are starting to contemplate sick leave. We can't keep pushing this group right now. It's I use the analogy of like elastic band. How far are you going to pull this band? Because they can't keep the pace, but they are a group that don't stop working. So thank goodness for them.
I wonder, Michelle, if you have any ideas or suggestions on what can be done to sort of alleviate the stress on these professionals and maybe to help process tests faster.
Really great question. The solution immediately, we are looking, I know the government is really looking right now at, could they look at expanding who can do rapid testing? So that's under discussion. There are actually some other provinces that have already made that jump. They've expanded the group of healthcare workers that could do rapid testing. And that example is Nova Scotia. They're doing it right now. So that would be the first thing. I think in a longer term perspective, we have 5 lab technologist program in Ontario. There isn't a program between Toronto and Windsor right now, and we are struggling up north. So I think if there was a large academic institution, a college, a university that's looking to increase a program, medical lab science is a very good program. We need more of them in Ontario.
Okay, and the last time we spoke, Michelle, we were talking about those rapid tests coming to Ontario. Any update on those?
They are apparently out within our community. They're just trying to get people trained up on how to use them. And again, they're trying to see if they can expand who could actually use them. I actually just heard a story out in Halifax, I believe, that you could actually drive in, you can get swabbed, sit in your car, and in 15 minutes when you leave, you're able to get a result.
Wow.
So we need to get that process happening here in Ontario.
It's impressive to see how far we've come in the last year. Hey, Michelle?
It's amazing. It's truly amazing.
Okay, well, thank you so much for your time and all of the work that lab professionals across the province are doing right now. Thank you, Michelle.
Have a great day.
You as well.